Good morning, everyone. Today, we'll look at another child-related problem, childhood autism. So, some of the parents must have heard or having children with artistic features. So, in childhood autism, where generally we call it a developmental disorder or pervasive developmental disorder. The reason why we call it pervasive because the limitations or the abnormalities that we are going to describe in the form of symptoms shortly now are interfering or coming in the way in all the situations. So mainly it is a developmental disorder, and most of the time the symptoms can be seen as early as infancy, and most of the times we can consider that there is no normal developmental period, especially if the children have an associated mentally challenged or retardation. So most of the times the symptoms are very early. Before 3 years, parents can recognize them. Looking at mainly in autism, generally it is more 3 to 4 times more in boys, and there are 3 areas of concern that we need to look at here. Mainly the communication pattern, social interactions, and these children have some restricted, stereotyped kind of activities or interest. So let's look at into details of these symptoms, which will help the parents to recognize these kinds of children at an early stage. So looking at the communication patterns, mainly these kids have difficulty in using the communication appropriately, and then they have difficulty in understanding the cues, especially the non-verbal cues, and then emotionally responding. The emotional reciprocity is something considered to be a deficit in these children, and which also will extend to difficulties in their socialization. So mainly in processing the emotional clues, the gestures, facial expressions, and non-verbal clues, and applying them, even though verbally they are communicative, applying these communication skills in the appropriate situations is a difficulty observed in these children. So that is with the communication. Looking at the social interactions, again, the limitations in the communications will again pose challenge in their interactional patterns, especially in terms of unable to respond to the emotional clues, gestures of the person, and having difficulty in responding to them. Especially the emotional aspect of it, and then unable to process the cues, social cues that are very important in the communication process. And then they usually have difficulty in imagination and fantasy kind of, there is limitations in the imagination and the fantasy of the children. The creative aspects of the communication are affected in these children. So this poses a lot of challenges during the developmental period in terms of restricted play activities, inability to mix with the peer group, and self-care difficulties come into picture. And in addition to these 2 areas, there are restricted, stereotyped kind of behaviors these children exhibit in terms of being very rigid in following the routine or timetables. They have these unusual kind of interest in certain movements that are not very useful like some body movements that they have as a stereotypical or continuous body movements that these children are indulged into. And then they are usually have some attachment. In some of the children, there is an attachment to non-soft parts of the objects, like sometimes it can be the smell of the object or the feel of the object. So they have these very restricted stereotyped interests and activities. And then apart from these symptoms, they will have certain non-specific symptoms like temper tantrums or easily aggressive. In some of the children, there can be a self-injurious behavior. Especially 1/3 of these autistic children have a kind of severe mental retardation. And so all these symptoms make the children much more needing the care, more intensive care. The earlier that one is able to recognize, usually the parents, the early intervention. We look at the management a little later, but the early intervention as early as 2 to 3 years can benefit these children, rather than moving on to post 5 years or 6 years. But even though in clinical practices, even the adults also diagnosed to be having an autistic come into clinical exposure in our practices. So these are the basic 3 symptoms, which I will again project them for your clarity in the form of slides at the end of this video, mainly in the area of communication, in the socialization pattern, and they have these stereotypical restricted interests in some of the areas. So these are the 3 symptoms that we will look at in childhood autism. Looking at the factors or the possible causes, definitely there can be a family history of similar kind of problems with the close family members. Genetic factors are one other risk factors that are seen. And there are some environmental influences, but not very definite kind of inference as far as in terms of how much they are the causes for autism. And for the most of the children, the cause may be unknown also. So focusing on the management of these children, mainly the management is a team approach, and we have to look at early intervention as much more effective than diagnosing it at a much later date. So here the team approach of different professionals, psychiatrist, child psychologist, or behavior therapist, and occupational therapist, speech therapist, nutrition, also to some extent, and then special education, all these services put together, the child needs an intensive kind of tailor-made program based on the age and the possibilities of the child. Along with the parental counseling, we'll go over briefly about these different kinds of services. Looking at the ABA. ABA is a program called Applied Behavioral Analysis. Here, the main focus is on step-by-step encouragement of training the children in increasing the desirable behaviors, usually starting from making them more independent in their day-to-day life skills like eating behaviors, eating habits, and their self-care habits, where increasing the desirable behaviors and also to decrease the undesirable behaviors. This applied behavior analysis program or behavior modification program is very effective. And looking at the medication part, none of these interventions or programs or the medication will cure autism. So let the parents or the viewers be clear, there is no cure for autism. So most of the services or interventions are mainly to kind of make the children's life more as independent and to reach their highest potential. So here, looking at applied behavior analysis program, mainly working on improving their behavior skills, desirable behavior skills, as well as decreasing their problems, like if the children has self-injurious behavior, or some of the children has problems in wrist biting kind of behavior problems, where the applied behavior analysis can be helpful. Medication, looking mainly at the medication, it is not for the cure, but in order to help to manage or decrease their high energy levels, protect them from fits or seizures, which these children, some of these children are prone for, and then to reduce these self-injurious behaviors, these medication will help them to a greater extent. Looking at the other important services where speech therapy is again to help them in order to improve their verbal communication. Sometimes there can be gestural and picture communication that they work on with. If the child has limitations in verbal communications. And occupational therapists are those therapists who mainly help them in order to become more independent, along with the behavior analysis training, by helping them to become more independent in their day-to-day functioning, in helping them to be as independent as in their self-care and other daily living skills. So there's another applied, or it's also called assistive technology, using computer assisted programs in order to teach them the communication, verbal communication, and sometimes it can be in the pictorial signals, where the child can use it as a communication process in order to express their wants whenever there is a requirement. So this is the assisted program using the software programs, computer designed programs for these children. So speech therapy, medication, and social skills training, again helping the children in order to kind of have a basic communication skills in interacting, helping them, even though these children have the communication and to some extent the abilities in order to socialize, using them appropriately, helping them sensitize to the cues of the non-verbal cues to some extent can be trained by using these social skills training. Looking at the parents are the main caretakers of these children. It is very, very important that the parents are involved into the child care and taking them to these programs, and then being available to the child without much returns can be very stressful to the parents. So it's important that the parents have the right knowledge about the condition of the child, and it is important for them to kind of look at the daily routines, even if changing of the furniture position or changing of the routines, these children can get disturbed very much. So maintaining the routines, maintaining the kind of a happy time. The focus of teaching the children here is more to do with the learning skills and making their life much more easier rather than for education purpose, and daily maintenance of their self-care and their basic life requirements is more important. Maintaining a qualitative play time with the children, because of their limitation in their social and then peer group, and also having families where similar children are there, in order to have a support system is of paramount importance. And of all, the most important is the acceptance of the child, that it is going to be a continuous helping of their children without much of the expectation of them seeing them or bringing them to a normal level. So the earlier the acceptance comes, the better will be the coping mechanism, coping and helping the children towards reaching their maximum potential. So it's important for the parents to maintain manage their stress levels, and cooperation of both parents is very, very important. If there are any additional other issues related to the couple or any other adult factors need to be worked through when you have children to be cared. And then it's important to be more hopeful and maintain these positive attitudes, help them to kind of have more nature-related kind of activities, a little bit of weekly once or twice visits to the park, and then nature kind of activities are much more relaxing to them, rather than taking them to activities related to more artificial kind of situations. So, so remaining hopeful and helping them unconditionally is very important here, along with the team approach and early recognition and working out on helping the children to have their lives as comfortable as. So this is all for this week, and then we'll look at about mental retardation and how we can handle this mental retardation. We will look at this particular topic in our next session. Thank you all. Take care.